It's great honor and blessing to introduce you to Dr. Morenikeji Komolafe. She's MBBS FWCP Diploma in Clinical Neurology from Queen Square, London. She's Fellow of World Stroke Organization, member of International Members Task Force of the American Academy of Sleep Medicine, member of the Diversity and Inclusion Committee of the Sleep Research Society and the World Sleep Society. She is the head of the multidisciplinary stroke team and the sleep research group of the Obafemi Awolowo University Teaching Hospital Complex, Ile-Ife, Nigeria. She is a professor of neurology in the Obafemi Awolowo University, Ile-Ife, Nigeria, and current head of the Department of Medicine. In recent years, she has focused on improving the awareness of stroke, epilepsy, and sleep disorders among health professionals and the general public by coordinating update lectures during the World Sleep Day in March. The awareness efforts for students also include lectures in schools and talks on the media, print, radio, and television. It's great honor to have you here, ma'am, and the stage is yours. Over to you.
Good morning, everyone. My name is Prof. Morenikeji Komolafe, and I'm a consultant neurologist at the Obafemi Awolowo University, Ile-Ife, Nigeria. I'm glad to be part of this Ubuntu conference. I'm a neurologist with interest in sleep medicine, and I'll be talking about the topic sleep medicine in Africa, the past, the present, and the future. I'll be using this outline. First, the current status of sleep medicine in Africa. Secondly, looking at research and publications. And thirdly, looking at the challenges to the practice of sleep medicine, unique needs and opportunities, and conclusion. This is a map of Africa. Africa is a very diverse continent, the second largest continent, and has various ethnicities, cultures, and languages. The population of Africa is young, and characteristic is presence of rapid urbanization. So people migrating from rural areas to urban areas and multiple areas of conflict. I'm from Nigeria, in West Africa, and in Nigeria, there are over 250 languages that are spoken. There are 3 major ethnic groups and a lot of other sub-ethnic groups. So the major ethnic groups are Yoruba, Hausa, and Igbo. So most of Africa is very diverse, as we can see. As regarding sleep societies, the various regions of Africa are shown here. North Africa has well-organized sleep society, and so does Southern Africa. West Africa, Eastern Africa, and Central Africa do not have well-organized sleep societies. The majority of publications for sleep disorders are in these areas. The commonest sleep disorders that occur include insomnia, parasomnia, sleep-related breathing disorders, hypersomnia, which includes disorders of excessive sleepiness like narcolepsy and other causes of excessive daytime sleepiness, circadian-related sleep disorders, for example, advanced sleep-phase disorders, delayed sleep-phase disorders, and shift work disorders. Sleep-related movement disorders like restless leg syndrome and sleep and neurological disorders are also common. For example, sleep disorders occur in patients with epilepsy, migraine, stroke, and neuroinfections. I will start with insomnia. Insomnia in Africa is very common in elderly women, and it is associated with anxiety and depression, particularly among young people who involved in video games. So you have association between insomnia and video game addiction. Also, sleep disorders occur in about 45% of university students. This is associated with use of social media, better use of phone and internet. So because of rapid urbanization and the stress of urban life, poor sleep has been observed in the majority of the urban areas. For example, Lagos in Nigeria, who have to wake up early to go to work as early as 4 a.m. and they come back very late at night. Also in Ethiopia, sleep has been associated with use of cats, which is very commonly used in Ethiopia. Also, sleep disorders could be a risk factor for suicidal ideation and also suicide itself. Parasomnia is quite common among medical students and nursing students. It's also found to be common among persons with epilepsy. And the various types of parasomnia include sleepwalking, sleep talking, confusional arousal. So parasomnia could be either related with REM sleep or non-REM sleep. There are a lot of misconceptions with parasomnia. A lot of people believe they are due to spiritual attacks, and therefore they do not present to hospital. They will rather present for alternative care. So most of the patients with parasomnia are found with traditional healers. In Yoruba land, these traditional healers are called babalawos. Also, some go to religious healers, for example, in white garment churches, where various treatments like holy water are prescribed to them. Sleep-related breathing disorders, example are obstructive sleep apnea. Prevalence of snoring is about 31%, and of course more in females. Also, in stroke, there's occurrence of obstructive sleep apnea and sleep-related hypoxemia as well. Sickle cell disease is a genetic disorder which is common in Western Nigeria, and it's found that obstructive sleep apnea and sleep-related hypoxemia are risk factors for painful crisis among patients with sickle cell disease. Sleep disorders are also common in tropical infections. For example, in trypanosomiasis, also known as sleeping sickness, there are a lot of inflammatory cytokines that are released. These cytokines have detrimental effect on the sleep-wake cycle. And as a result of this, patients have a dysregulation of orexin diurnal activity, and they tend to sleep more during the day. And towards the latter end of the disease, they continue to sleep until they die. In HIV infection as well, patients have poor quality of sleep. They have a longer onset sleep latency, they have a shorter sleep time, and the quality of sleep in patients on antiretroviral drug in an urban population is very poor. So these are due to various risk factors. For example, various genetic factors and cytokine polymorphisms are associated with poor sleep maintenance among adults with HIV infection. Then there's also peculiarity of African genes and sleep. So the circadian genes affect timing of sleep. Individuals with African heritage have been found to have various peculiarities of sleep. For example, we have higher prevalence of short sleepers, less than 5 hours, and long sleepers, more than 9 hours. They have different sleep architecture, having less of stage 3 non-REM compared to other ethnic groups. And they also have higher cardiovascular risk among the short sleepers. Then, in relation to this topic, I want to look at sleep and culture in Africa. In Africa, sleep disorders are under-recognized. For example, in Nigeria, patients with snoring will not report to hospital because it's believed that snoring is a sign of a deep sleep. Also, parents of children with sleep disorders, various sleep disorders, do not recognize it and do not report it. In particular, children with enuresis, that's bedwetting during sleep, are not recognized. Even those children might be punished or abused. As a consequence of this, sleep disorders are undertreated, and most people resort to traditional methods for treatment of sleep disorders. For example, patients with obstructive sleep apnea locally go to traditional healers who remove their tonsils as a method of treatment. Also, in ancient Egypt, um, there were sleep temples which were used to treat diseases, and patients with medical illnesses were um, in those temples, and the sleep was part of the prescription for treatment of the various disorders. So in ancient Egypt, sleep disorders were recognized, and the use of sedatives for insomnia was also in practice. In Nigeria, like I said earlier, there's a perception that snoring is a sign of normal sleep and it shows that the person is sleeping deeply. Also, any nocturnal event in Yoruba land is perceived as an attack. For example, parasomnias or nightmares, and often patients go to traditional healers to interpret their dreams and for any disorder that occurs in the night. This has been reported by Korea et al. And I know. So, condition known as Ogun in Yoruba is night warfare, and it's a form of terrible nightmare which wakes the patient up. And like I said earlier, is considered a form of spiritual attack, and patients do not report to hospital. So, also in Africa, co-sleeping is common and acceptable culturally. Sleep and African neurology. Sleep and epilepsy are strange bedfellows. Parasomnias and nightmares are common among persons with epilepsy. This has been reported by my group. Some of our patients report vivid nightmares, patients seeing masquerade chasing them and all that. And the lack of sleep contributes to continuous seizures in these patients. So patients with epilepsy have to be asked about presence of sleep disorders, and this has to be treated. Also, frequency of poor sleep is also high in migraine, up to 60%, have a short sleep duration and long sleep latency, and this has a negative impact on personal health, work, and productivity of these patients. However, with all these problems, there are a lot of areas of opportunities. The challenges for sleep medicine in Africa includes very few research going on and publications, lack of available services. For example, in Nigeria, there are very few sleep labs. Challenges with training and certification. For example, in Nigeria, there are no organized certification for sleep medicine. Also, lack of trained professionals and lack of sleep association. The same thing applies to treatments. Available treatments are not universally accessible to patients. In terms of services and training, like I said earlier, the services are limited and training of personnel are also limited. There are no certification exams for sleep medicine. Well, available treatments are not easily accessible, and most patients buy drugs over the counter. So collaboration with international organizations, for example, American Academy of Sleep Medicine, will help to improve the situation for sleep medicine in Africa. And also there should be collaboration between orthodox and then the traditional healers. Training should be organized for all cadres of health worker, and telehealth is another option that can be considered. In spite of these challenges, there are a lot of opportunities. So needed urgently are awareness campaigns, training, like I said earlier, and sleep medicine has to be incorporated into the primary health care. So in most countries in Africa, primary health care is not functioning very well, particularly in West Africa and in Nigeria. Health insurance is not covering most of the population, and if availability of health insurance will improve access to safe services. Telehealth is an option that can be considered for rural populations. So needed on the longer term is the capacity building, training, certification, and then collaborations, both within the continent and outside the continent. So in summary, I've discussed sleep medicine in Africa, past, present, and future, looking at the current situation, challenges, and opportunities. Thank you so much for your attention. Eshe púpọ̀.
Thank you so much, ma'am. It was wonderful. I have a request to all the speakers and delegates that due to internet and power failure from that side, few of our speakers from South Africa and even other Africa. People from Zimbabwe and also Morenikeji ma'am, they sent their videos, and they now because of that we were able to have their presence here, virtual presence. But as because of inability of some speakers to be present at question and answers session, we are whole session, this session is getting preponed, and that's why Morenikeji ma'am, who was supposed to be present after half an hour to be present here for question and answer session, she is not able to be present. So we will prepone next presentations, and then we will invite her. She will be available that time. Hopefully we will have power and internet support that time, and we are really praying for that. Thank you so much for your understanding.